Okay, so we're talking about the clinical case reports. Clinical case reports. For this report, we are coming to look at the other side on writing a case report. Normally, um, a case report. Normally, a case report is a detailed account of a single patient's symptoms, signs, diagnosis, treatment, and follow up, often used to highlight an unusual or a novel medical occurrence. So, the normal case report that we write consists of the diagnosis, the symptoms, the signs, the treatment, and the follow up, often used to highlight an unusual or a novel medical occurrence. That's what a case report is about. That's what a case report is about. And we have a case report and a case presentation. Normally, for case reports can be in a Word document, and also they can be in a PDF form. Can be in a PDF form. For case presentation, for case presentation and case report, there are two different things. A case report is a formal written publication about a single patient's case, including their symptoms, diagnosis, treatments, follow-up, often focusing on unusual or a novel occurrence. And a case presentation, but a case presentation is a more informal, often oral communication of a patient's clinical information between healthcare professionals serving as a teaching or and learning tool. The for case presentation, normally for that one, the form of communication is oral. Yeah. But today we are about to focus more on the clinical case reports in a different phase from the normal ones that we write. So for this one, it will be detailed, or for this case reports, it will be detailed on the objectives and the competencies given, to be detailed on a specific or the objectives and the competencies given. So this case report will help you to write any case report which demands you to stick to the objectives and the competencies to write that case report, away from the normal case report that we usually write. So to start, we have to know the objectives and the competencies that we were given to us, or that we were given. So for the objectives, one, we have to demonstrate safe evidence-based nursing and midwifery practice. Two, apply the nursing processes in the care of patients or clients. Three, practice infection prevention and control measures consistently. Communicate effectively with patient families and the healthcare team. 5, accurately document all nursing and midwifery or all nursing and midwifery care provided. 6, exhibit professional, ethical, compassionate behavior in patient care. So those are the objectives that were given to us. Let's go to the competencies. For the competencies, one, So firstly, let me explain what competencies are. So competencies are the combination of knowledge, skills, attitudes, and personal characteristics needed to perform a task or function effectively. So for competencies, these are the skills, the knowledge, attitudes, and personal characteristics that are needed together to perform a task or a function effectively. So the first competencies given was one, perform planned and emergency admission of patients. Two, practice infection prevention and control measures. Three, apply body mechanics in nursing patients. Four, nurse patients in various positions. Five, make beds suitable for patient condition. Six, check and record all vital signs. Seven, serve and remove bedpans and urinals correctly. 8, take a detailed nursing health history of all patients. And 9, assist with blood transfusion. 10, observe patients for blood transfusion reactions, intervene and report immediately. 11, nurse patients on admission using the nursing care plan and nursing process. 12, bath patients and care for pressure areas. 13, assist with mouth care of seriously ill patients. 14, dress all types of wounds using instruments. 15, care for wound drains and remove them. 16, identify types of exudates or drainage from wounds. So exudates, they are the fluids that comes from the blood vessels. Yeah. 17, identify various types of wound. We have open wound, closed wounds, clean cut wound, and those types. 8, we have assist with removal of sutures. Assist with removal of sutures. Normally, when we talk about sutures they are also called stitches. You can say sutures or what stitches. Those sutures, they are medical devices, typically a needle and a thread, used to close wounds or surgical insertion by holding body tissues together. 19, administer oral medication. Oral medication, that's medication that are or medication which has its routes to be in the mouth. 20 is to feed ill and very weak patients. 21, record intake and outputs and balance appropriately. Intake and outputs will equal to what? The balance. And 22, observe, record and report accurately. That's documentation. So we are going to base on these objectives and competencies to write our case reports. So this type of case reports can be used when you are given the objectives and what the competence. But when you are not given any objectives and competences, for that one you will stick to the normal way of writing the case report. For the normal way of writing the case report, for that one you have to include the patient's signs, symptoms, diagnosis, and other things which helped in the treatment of that patient. You can also include the patient particulars as well. Yeah, that's the age, sex, and maybe the date of birth. So let's start with today's activity, a clinical case report. So when writing a case report, normally the case report they are written for students. They are written after maybe after a clinical practice. Yeah. So for this one, we are looking at a student who was a student of Ken University who is supposed to write a case report on his um, clinical experience. Yeah. So normally for clinical practice, we have a period of time it lasts for. So for this one, it was a 6 week clinical experience. So in writing a case report, you can start with the introduction. You can have your way of starting, but the normal structure, you can have the introduction first. So for this introduction, it says this report reflects on my 6 week clinical experience in nursing and midwifery one at the School of Nursing and Midwifery College of Health Sciences, Kwame Nkrumah University of Science and Technology. The experience was designed to achieve specific objectives and competencies outlined for the clinical placement. For this one, you can just have your own way of introducing it, but this is just a sample of how you are going to do it. After this one, you can have the achievement of objectives. Mind you, you can use any way of writing it, but this how it has to supposed to be. We have some basic structures or some important steps you have to include in writing this what case report. So for achievement of objectives, the one um demonstrate safe, evidence-based nursing or midwifery practice. So I applied evidence-based guidelines in patient care, ensuring safety and best outcomes. The second one, apply the nursing processes or the nursing process. I use the nursing process in caring for patients and clients, assessing, diagnosing, planning, implementing, and evaluating care. Third one, practice infection prevention control measures. So I consistently followed infection control protocols to minimize risk. The fourth one, communicate effectively. I communicated with patients, families, and the healthcare team to ensure coordinated care. The fifth one was accurately document care. I maintain accurate records of nursing and midwifery care provided, exhibit professional, ethical, and compassionate behavior. I demonstrated professionalism and, and compassion in all interactions. So, for the objectives aspect, you can combine both the objectives and the competencies together. For that one, you have to know how you combine it and to make the report very nice. For this one, we just tackled on how we're able to achieve the objectives that we're given. So this one, the objectives, we separated it from what the competences. So you can also add some stuffs of yours that will be helpful in writing it. So for this case reports, the basic things or what the structure of this case reports is that for this case reports, we will be um, recounting on the challenges we encountered in achieving the competencies and objectives as well. And also, the objectives and competencies must be accounted in the report on how you achieved what each of them, how you navigated through those challenges, and the lessons that you learned in the clinical practice. So, these are the things that we will see in this report. And now we are done with how we achieved the objectives. Achievement of competences. So, as I said earlier, you can decide to combine the two of them to be achievement of competences and what objectives. So, for this sample, we just separated your achievement of objectives from the what achievement of competences. The achievement of competencies: 1. Perform planned and emergency admission of patients. So that was what was given. How did you achieve this? I manage admissions effectively. This is very short. You can add something else to it as well to elaborate on what really went on. The second one is practice infection prevention and control. Consistent application of protocols. Apply body mechanics. I use proper body mechanics to prevent injury. The fourth one, nurse patient in various positions. Adapted I adapted care to patient needs. The fifth one, make beds suitable for patient condition. Adjusted beds for patient comfort and safety. So this structure for this one, we first write what we were meant to do. Then the second part is what we did to achieve what that goal. So let's move on to the sixth one. Check and record vital signs. So regular monitoring and documentation. Serve and remove bedpans or urinals correctly. So manage with care and hygiene. 8. Take detailed nursing health history. Comprehensive histories were taken. 9. Assist with blood transfusion. So I assisted safely under supervision. 10. Observe for blood transfusion reactions. Monitored and reported as needed. Nurse patient using nursing care plan and nursing process. Applied care plans. So this means the person achieved that by using the care plans. Bath patients and care for pressure areas. So prevented skin breakdown. And we know normally it's the relatives of the patient that bath the patients at the ward. Yeah. 13. Assist with mouth care for seriously ill patients. So we provided specialized care. 14. Dress wounds using instrument followed sterile techniques. Sterile techniques means sterile can be also be aseptic, which means free from what contamination. Free from contamination. So now we are done with how we were able to achieve the competencies and the objectives. So we are coming to look at the challenges encountered. The challenges encountered. So for the challenges encountered, in writing this case report, you can either blend the challenges encountered with how you achieved it. But for this one, we've separated the challenges we encountered from how we achieved. So challenges encountered: balancing thorough documentation with time constraints, managing stress in high pressure situations, ensuring consistent infection control practices in busy settings. So these are the challenges the person encountered. So for the first one, the person was finding challenges with how um, he is going to balance a well documented um, documentation with time. Yeah, with time. And also managing stress in high pressure situations was a problem to the person. The last one was always ensuring infection control practice was a challenge to him as well due to busy settings. So we can all testify that when sometimes there was normally at the emergency ward, you found yourself very busy and you can't even um, follow the protocols for infection control practices. So that was the challenges the person encountered. So right now we are going to look at the navigation of challenges, how the person was able to survive or overcome in these what challenges. So the first one for the challenges we listed balancing thorough documentation with time constraints. To avoid any confusion, when we are starting with the navigation of challenges, start with what you wrote for the challenges. The first one first for the navigation, second one for the challenges must also follow the second one what for um the navigation as well. So the first one we talk about for the challenges was balancing thorough documentation with time constraint. What did he do? Or what did the person do? So for the navigation of challenges, you are talking about how the person overcome those challenges. So the person overcome those challenges by using time management strategies which help with what documentation. So the person manage the time very very well. The next one, stress management techniques like deep breathing were used. You see, the challenge that he wrote was managing stress in high pressure situations. He was finding it very difficult to manage stress. So what or how he navigated or how the person navigated through this challenge was that use some stress management technique like deep breathing. That really helped the person to overcome that challenge. The last one was where the last challenge was ensuring consistent infection control practices in busy settings. So what the person did was reinforcing infection prevention control protocols through practice and reminders. So the person was able to um, reinforce infection control by reminders and through practice, more like constant practice, and also using reminders as well. So these were how those challenges listed above were what's navigated. This were how they were overcome. The lessons learned. First one, importance of evidence-based practice for patient safety. We can see that the person learned that using an evidence-based practice. So evidence-based practice is an approach that integrates the best available research evidence with clinical expertise and the patient or client's unique values and circumstances to inform decision making in fields like medicine, nursing, psychology, and education. So evidence-based practice is solely due on historical practices. So the person learned that evidence-based practice helped what in patient what safety. The next one was effective communication enhances patient outcomes. So when you are able to establish a good rapport with a patient, you get to know the patient very much, and the patient also feels very comfortable when you are present. So if there is anything worrying him or her, the person can just open up to you. So effective communication enhances patient outcome. So that's what the person learned from it. Continuous practice of infection control is very crucial. So when you practice the infection control measures or follow the protocols, it helps you and it avoids you being infected. It avoids you being infected with any disease, and reflective practice is in personal and professional growth. So reflective practice more or less always when you go to the hospital, you just recall, write down the things that went on, how you navigated through, and the lessons that you learned. So the person saw that okay, what he was doing was very good, and it helped him grow professionally. So after writing all that were required of us, you can just conclude by for this one. The conclusion was this: 6 week clinical experience was invaluable for applying theoretical knowledge to practice. So what the person is saying here was that for the 6 week clinical practice helped him to apply all that he has learned theoretically into what practice. So you learn vital signs in class. When you go to the world or when you go to the field to practice, you have the opportunity to see the instruments you'll be working with. And unfortunately, you also get the opportunity to use those instruments to check the vitals of what various patients. That will give you, or that will expose you to how it is being done more than learning it theoretically. Achieving the objectives and competencies enhance my skills, confidence in nursing, midwifery care. So um, that's all about how you can go about in writing a clinical case report when you are being demanded to stick to the objectives and the competencies you were given. And for this case report, it was included that we have to write on the achievement of the objectives, achievement of the competencies, the lesson learned, and also the challenges as well, the challenges faced, and how those challenges were what navigated. So these were the basic things which were required of us to write. So whenever you get any clinical case reports demanding you to stick to the objectives and the competencies that were given, you can go about this structure to write it. You can go about this structure to write it. As I said earlier, for the clinical case reports, normally, normally, in writing the clinical case reports, you have to include the patient's signs, patient symptoms, the patient diagnosis, and other medical history. So you can also include the patient's age, sex, education background, and any other thing else that is relevant in writing the case report. But for this case report, it is different from um, the normal case report I said earlier. This one is different from the normal case report I said earlier. For this one, we are sticking to the objectives and the competences that were given to us. And we were also tasked to write on the lessons learned, the challenges encountered, how we navigated through those challenges, and also how we achieved the objectives and the competences. So this is the structure that you can use in writing such case reports. This is the structure that you can use in writing such case report. So you can either start with the introduction, or you can start with the introduction and end with the conclusion, or you can either start with the introduction. You can choose to ignore any conclusion, but you can have a way of concluding everything that you said And also you can blend both the achievements and the objectives, the achievement of objectives and the achievement of competences together. Yeah. Or in you can also blend the challenges you face together with how you achieve them, and later on write how you navigated through all of them, and also include the lessons learned. So this is basically how to go about this post. Thank you.